If you have endometriosis, you already know the journey to getting the right care can be, well, incredibly frustrating, especially when you're trying to navigate a subsidized healthcare system. So in this explainer, we're going to break down why that is and, more importantly, what you can actually do about it.
This right here, this is the question, isn't it? It's the one at the very heart of this entire conversation. And if you've ever found yourself asking this, I want you to know you are so not alone. The frustration is real and the answers aren't simple, but they are there.
Okay, let's just sit with that for a second. This is a really blunt and honestly a really important statement from advocates who are on the ground. It validates what so many people have felt and experienced themselves, that finding a true specialist for the really complex cases in the public system, it's become unbelievably difficult.
So this isn't just a feeling, you know? It's not just a one-off bad experience. It's a recognized reality. There's a tangible gap in specialist care, and we've got to understand it before we can figure out how to get around it. So where did all the specialists go? Well, here's the thing. It's not that they've vanished. It's that there's been a major systemic shift. A lot of them have moved into private practice. And as advocates and doctors have confirmed, that's meant fewer dedicated clinics inside the public system, which of course makes it so much harder to get that expert care.
But why? I mean, why is a specialist so crucial? Why can't just any gynecologist handle it? Let's take a look, because the answer is really found in the very nature of endometriosis itself.
And this right here, this says it all. Endometriosis is not just a bad period. No way. It's a complex, systemic, inflammatory disease. I mean, just look at those words. That definition alone tells you this isn't a simple fix. It needs deep, specialized knowledge, often from a whole team of different doctors, and it needs continuous, long-term care. Now, it's really important to say this isn't about blaming the generalist O&G doctors. Not at all. They are working under some serious constraints. They have very limited time with each patient, they're using broad protocols meant for tons of different conditions, and you often can't even choose to see the same doctor every time for follow-ups. And when you have those constraints, what happens? Well, you get exactly what so many patients report. A diagnosis that takes years, a painful cycle of trying treatments that just don't work, and that awful experience of having your symptoms minimized or just flat out dismissed. It's a system problem with a deeply personal impact.
Okay, so that's the reality of the situation. The big question is, what can you actually do? So now we're going to walk through two practical pathways you can consider. And the first one is something called the hybrid approach. It's all about using both the private and the public systems to your advantage.
Here's how it works. First, if you can, you see a private specialist to get that solid diagnosis and a real effective treatment plan. Then, once you're on the right track, you get a detailed memo from them. Now, this memo is the key. You take it back to a polyclinic, get a referral, and use it for your follow-up care and your medication refills back in the subsidized system. It basically gives the next doctor a clear, expert-led roadmap to follow for your care.
Okay, but what if that hybrid approach just isn't an option? What if you need that specialist care, but the cost is a major barrier? Well, that brings us to our second pathway, actively going out and seeking financial assistance. Look, I know this can feel like a whole other battle, but it's so important to explore. Your first stop should be the hospital's medical social worker. They are your best resource for what aid is out there. You can apply for financial aid schemes, and sometimes even writing to your member of parliament can open up doors for support. Please remember, there is absolutely no shame in asking for help. It's a necessary step for so many.
Now, both of those pathways, they really rely on one single fundamental skill. And this is especially true if you have to navigate the public system exclusively. And that skill is the power of self-advocacy. It is the foundation that makes everything else work.
You can think of these as your personal toolkit. It all starts with trusting yourself, knowing what is and what is not normal for your body. It's about finding the confidence to say, no, my pain is real. It's knowing when the time is right to ask to speak to someone more senior, or to just say, I would like a second opinion. Taking these steps can literally change the entire course of your care.
Let's just be really clear as we wrap things up, none of this is ideal. Having to figure out workarounds is a sign that the system isn't fully meeting the needs of patients with a disease this complex. And just acknowledging that this isn't fair, that's an important first step. And if you take just one thing away from all of this today, please let it be this. When you are pushing for better care, when you're asking for answers, when you are fighting for relief from your pain, you are not being difficult. You are not asking for too much.
All you are doing is asking for a medical response that is appropriate for how complex your disease actually is.
It is a completely logical and a completely necessary request.
And that is 100% reasonable. Don't ever forget it. Thanks for tuning in.